Have you ever woken up with a persistent, heavy headache that just won't go away? You might think it's because of poor sleep or stress, but what if I told you that this could be a sign of something much more serious: high blood pressure? It's something many people overlook, thinking it's just a normal part of aging, but it can actually be a warning sign of a silent health issue. High blood pressure puts extra pressure on your blood vessels, including those in your brain, and this can lead to problems like headaches, blurred vision, and dizziness, especially in the morning. In today's video, we'll look at why morning headaches are often tied to high blood pressure, and what you can do to manage your blood pressure before it becomes a bigger health risk. Stay tuned until the end, where I'll show you simple, effective ways to monitor your blood pressure at home, something that could really help prevent more serious issues down the road. And before we dive in, let me know in the comments, have you ever had a morning headache that just wouldn't go away? It's a lot more common than you think, and your experience could help someone else recognize the signs. Sign number 1, frequent morning headaches. Do you often wake up with a heavy, persistent headache? You might think it's due to poor sleep, stress, or dehydration. But if this happens regularly, especially in the morning, it could be an important warning sign of high blood pressure. High blood pressure puts extra strain on your blood vessels, especially those in the brain. When blood pressure rises overnight or early in the morning, blood flow to the brain can become unstable, leading to headaches when you wake up. Some people describe it as a tight band around their head, a throbbing sensation, or a persistent dull ache that lasts for hours. Not all morning headaches are caused by high blood pressure. However, if they come with blurred vision, dizziness, nausea, or a racing heartbeat, it's crucial to check your blood pressure. These symptoms may indicate a sudden blood pressure spike, which, if left unmanaged, can increase the risk of stroke or serious heart problems. Blood pressure naturally fluctuates throughout the day. At night, it usually drops as the body rests. But in the morning, the body produces cortisol and adrenaline to wake up the nervous system and prepare for the day. These hormones also cause blood vessels to constrict, which can lead to an early morning blood pressure surge. If your blood pressure is already high, this surge can be excessive, triggering headaches and other symptoms. This is also why many heart attacks and strokes occur in the morning. Some lifestyle factors can make morning blood pressure spikes worse. Diets high in salt can cause fluid retention, increasing pressure on blood vessels. Dehydration can lead to blood vessel constriction, making it harder for blood pressure to stay stable. Poor sleep quality or interrupted sleep can disrupt the nervous system, raising blood pressure levels. Lack of physical activity can also contribute to blood pressure instability throughout the day. If you experience morning headaches only occasionally, there's probably no need to worry. However, if they occur frequently, especially alongside dizziness, blurred vision, nausea, ringing in the ears, or rapid heartbeats, it may be a sign of morning hypertension. If your morning blood pressure consistently reads 140/90 mmHg or higher, it's best to consult a doctor. Fortunately, there are effective ways to manage blood pressure and reduce morning headaches. First, monitor your blood pressure regularly, especially in the morning before eating or drinking anything. Keeping a daily log can help your doctor assess your condition more accurately. Improving sleep quality is also essential. Try to go to bed and wake up at the same time every day, and avoid caffeine or heavy meals late at night. A restful night's sleep helps regulate blood pressure naturally. Your diet plays a crucial role, too. Reducing salt intake, especially from processed foods like canned goods, bread, or fast food, can significantly help. Instead of salt, consider using natural seasonings like garlic, lemon, or black pepper to add flavor without affecting your blood pressure. Also, increasing potassium-rich foods like bananas, avocados, oranges, and leafy greens can help balance blood pressure levels. Staying hydrated is important. When your body lacks water, blood vessels can constrict, causing a rise in blood pressure. Try drinking a glass of water first thing in the morning to help your circulation adjust smoothly. Gentle morning movement can also help stabilize blood pressure. Avoid jumping out of bed too quickly. Instead, take a few moments to stretch and move your body before standing up. A short walk or some deep breathing exercises can also improve blood flow. Managing stress is key as well. Practicing meditation or slow breathing exercises in the morning can help the body relax and maintain stable blood pressure. If you feel tense throughout the day, set aside a few minutes to listen to calming music, read a book, or do something you enjoy. Morning headaches may seem harmless, but if they happen often, especially alongside dizziness, blurred vision, or nausea, it's essential to monitor your blood pressure. The good news is that high blood pressure can be managed with a healthy diet, lifestyle adjustments, and regular monitoring. Don't wait until complications arise. Take control of your health today and protect your heart for the long run. Sign number 2, irregularly fast heartbeat. Have you ever felt your heart pounding rapidly even when you're sitting still? A racing or forceful heartbeat can be unsettling. Sometimes, this happens due to stress, anxiety, or drinking too much caffeine. However, if you frequently experience a fast heartbeat without any clear reason, it could be a warning sign of high blood pressure or heart-related issues. High blood pressure forces the heart to work harder to pump blood through narrowed arteries. When the pressure in your blood vessels is too high, your heart has to beat faster to maintain proper circulation. This can cause palpitations, a rapid heartbeat, or a strong thumping sensation in your chest, even at rest. A normal resting heart rate is between 60 to 100 beats per minute, but if your heart rate frequently exceeds 100 beats per minute, especially when you're not exerting yourself or under stress, it may be a sign that you need medical attention. A rapid heartbeat isn't just uncomfortable, it can also increase the risk of heart attack, heart failure, or stroke if left unchecked. Over time, excessive strain on the heart can weaken it, reducing its ability to pump blood efficiently. Some people may also experience chest pain, dizziness, or lightheadedness when standing up. If you notice these symptoms along with a consistently fast heartbeat, seek medical advice immediately. There are several potential causes of an increased heart rate, including high blood pressure, stress, dehydration, lack of sleep, certain medications, and excessive caffeine intake. When you're stressed, your body releases adrenaline, which increases your heart rate as part of the fight or flight response. If you already have high blood pressure, this combination can put significant stress on your cardiovascular system. If your heart frequently beats faster than normal without a clear cause, there are steps you can take to manage the situation. Start by monitoring your heart rate when you're at rest, such as first thing in the morning before getting out of bed. If your resting heart rate is consistently over 100 beats per minute for several days, consult a doctor for further evaluation. Keeping an eye on your blood pressure is also essential since high blood pressure can contribute to an increased heart rate. If your blood pressure readings exceed 120/80 mmHg, regular monitoring and lifestyle adjustments may be necessary. Reducing caffeine, alcohol, and stimulants can help stabilize your heart rate. If you consume multiple cups of coffee or tea daily, try gradually cutting back to see if your heart rate normalizes. Staying hydrated is also crucial. When the body is dehydrated, the heart has to work harder to circulate blood, which can lead to an elevated heart rate. Be sure to drink enough water throughout the day, especially in the morning after waking up. Stress is one of the biggest triggers for a rapid heartbeat. If you notice that your heart races during moments of anxiety or tension, try relaxation techniques such as deep breathing, meditation, or listening to calming music. Taking just a few minutes to focus on slow, deep breaths can help bring your heart rate back to normal. Gentle exercise can also help regulate your heart rate over time. If you frequently experience a fast heartbeat, choose low-impact activities like walking, swimming, or yoga rather than high-intensity workouts that may overwork your heart. Another key factor is sleep. Lack of sleep can elevate both your heart rate and blood pressure, making you feel more fatigued and stressed the next day. Aim for 7 to 8 hours of sleep each night, and try to maintain a consistent sleep schedule to support overall heart health. If you've made these lifestyle adjustments and still experience frequent episodes of a fast heartbeat, don't ignore it. Consult a doctor for further testing, such as an electrocardiogram, EKG, echocardiogram, or blood tests to identify any underlying heart conditions. Listening to your body is key to protecting your health. If your heart beats faster than normal even when you're at rest, don't dismiss it. Keep track of your heart rate, manage your blood pressure, and make small changes to maintain a strong and healthy heart. Sign number 3, dizziness and loss of balance. Have you ever suddenly felt lightheaded or lost your balance when standing up? At first, you might think it's just from standing up too quickly, but if this happens frequently, you should pay close attention to your blood pressure. Unstable blood pressure can affect the supply of blood to your brain, causing temporary dizziness or even putting you at risk of falling. Dizziness upon standing is a common sign of fluctuating blood pressure, especially in people with high blood pressure or orthostatic hypertension, a drop in blood pressure upon standing. When you shift positions suddenly, your body needs to adjust blood pressure quickly to ensure adequate blood flow to the brain. If your blood vessels and heart don't respond in time, you may feel lightheaded or disoriented for a few seconds. For older adults, this is even more concerning because a single fall can lead to serious injuries like broken bones or head trauma. There are many reasons why you might feel dizzy upon standing. Dehydration is a common culprit. When your body lacks enough water, blood volume decreases, making it harder for your blood pressure to stay stable. Additionally, a poor diet, certain medications, or underlying heart conditions can cause this issue. In particular, if you frequently feel dizzy along with symptoms like blurred vision, ringing in the ears, sudden weakness, or a racing heartbeat, it's time to check your blood pressure and consult your doctor for a thorough evaluation. To reduce the risk of dizziness and loss of balance, try changing your position gradually. Before standing up, sit upright for a few seconds so your body has time to adjust. Make sure to drink enough water throughout the day to stay hydrated and support healthy circulation. A nutrient-rich diet is also important. Adding foods high in potassium, calcium, and magnesium can help maintain stable blood pressure. If you need to stand for long periods, move gently in place to prevent blood from pooling in your legs and lower the risk of a sudden drop in blood pressure. In addition, maintaining a healthy lifestyle can help you better manage dizziness. Regular exercise, especially light activities like yoga, walking, or deep breathing exercises, can improve blood circulation and enhance your body's balance. If you feel stressed or anxious, take time to relax, practice deep breathing, or try meditation. These methods can not only reduce dizziness but also help your blood pressure remain steady. If you've made these changes and still frequently feel dizzy when standing up, don't ignore this warning sign. Monitor your blood pressure regularly and speak with a doctor to identify the root cause and find the right treatment. Stable blood pressure and good circulation can help you avoid uncomfortable dizzy spells and protect you from more serious health risks in the future. Have you ever experienced dizziness when standing up? Share your experience in the comments below so we can discuss how to improve blood pressure health. Sign number 4, unexplained nosebleeds. Have you ever experienced a sudden nosebleed without any injury? At first, you might think it's just due to dry weather or a burst blood vessel in your nose. However, if it happens frequently without a clear cause, this could be a crucial warning sign of high blood pressure. High blood pressure increases pressure within the blood vessels, including the fragile capillaries in the nose. When this pressure becomes too great, it can damage or rupture those blood vessels, resulting in a nosebleed. Even a minor action like blowing your nose or sneezing can trigger bleeding if your blood pressure is unstable. Nosebleeds are often overlooked. Many people simply wipe away the blood and continue their day without considering the underlying cause. However, if you notice recurrent nosebleeds, particularly without any apparent trauma, it's time to check your blood pressure. Unexplained nosebleeds might be an early indicator that your blood pressure is at a dangerous level. When should you be concerned? If you experience nosebleeds more than once a week, if the bleeding is hard to stop or lasts longer than a few minutes, or if it's accompanied by symptoms like headaches, dizziness, or blurred vision, you should check your blood pressure right away. These symptoms may indicate that your blood pressure is fluctuating dangerously and that your blood vessels are under strain. Uncontrolled high blood pressure can lead to serious complications, such as stroke, heart disease, or kidney damage. How can you reduce the risk of nosebleeds caused by high blood pressure? Start by monitoring your blood pressure regularly. Measure it in the morning and evening to detect any unusual changes, and keep a record of your readings so your doctor can better understand your condition. Making lifestyle changes is also a key step in protecting your blood vessels. If you have high blood pressure, adjusting your diet and daily habits can reduce the risk of blood vessel damage. Lower your salt intake. Eat plenty of green vegetables, fruits, and potassium-rich foods to help balance your blood pressure. Maintaining proper humidity levels at home can help prevent dry nasal passages. If you live in a dry climate, use a humidifier to keep your nasal tissues moist and reduce the chance of bleeding. Limit alcohol consumption and avoid smoking, as both can increase blood pressure and exacerbate blood vessel damage. Engaging in light exercise such as walking, yoga, or swimming can improve blood circulation and help stabilize your blood pressure. If you continue to experience unexplained nosebleeds, consult a doctor. They may perform tests to measure your blood pressure, assess any damage to your blood vessels, or check for other medical conditions. By addressing the issue promptly, you can prevent future nosebleeds and safeguard your cardiovascular health. Nosebleeds may not seem serious at first, but if they occur repeatedly without a clear cause, take them as a vital signal to check your blood pressure and seek medical advice. Sign number 5, shortness of breath during light activity. Do you feel out of breath easily after just climbing a few stairs or taking a short walk? If you feel fatigued and short of breath even during routine activities that previously weren't an issue, this might be an important indicator of high blood pressure or underlying heart problems. When blood pressure rises, the heart has to work harder to pump blood throughout the body. This increased pressure on blood vessels doesn't just strain the heart but also impacts the lungs, making you more prone to shortness of breath even during simple tasks. This is especially true if the arteries supplying blood to the heart are narrowed or stiffened, reducing the flow of blood and oxygen to vital organs. Feeling a little winded after a high-intensity workout can be completely normal. However, if you regularly find yourself unable to handle basic tasks like cleaning the house, walking a short distance, or climbing a flight of stairs without stopping to catch your breath, it's time to take notice. Feeling short of breath and fatigued in these situations can indicate that your blood pressure is out of control or that you're at a higher risk of serious cardiovascular conditions. Furthermore, if shortness of breath is accompanied by symptoms like chest pain, palpitations, or dizziness, it's a clear warning sign that you need to see a doctor immediately. Uncontrolled high blood pressure can lead to heart failure, an enlarged heart, and an increased risk of heart attack or stroke. So, what can you do to improve this condition? Regularly monitor your blood pressure. Keep track of your blood pressure readings daily, especially after you feel short of breath. If your readings consistently stay above 140/90 mmHg, consult a doctor. Making lifestyle changes is also an important step. Start by cutting down on salt intake. A low-sodium diet helps relieve pressure on blood vessels and reduces the risk of shortness of breath caused by overworked heart and lungs. Maintain a healthy weight. Being overweight adds extra strain on the heart. Losing weight, if needed, can improve your breathing and help manage your blood pressure. Incorporate gentle exercises. If you're not accustomed to physical activity, begin with light exercises like slow walking, yoga, or deep breathing exercises. These can improve circulation, boost cardiovascular health, and prevent you from quickly feeling exhausted. Manage stress levels. Stress and anxiety can cause sudden spikes in blood pressure, making you feel more fatigued and short of breath. Practice meditation, deep breathing, or relaxation techniques to help lower stress levels and reduce pressure on your heart. If these lifestyle adjustments don't alleviate your symptoms or if you continue feeling short of breath and fatigue despite making changes, consult a doctor for a more detailed evaluation. Tests such as echocardiograms, electrocardiograms, EKG, or pulmonary function tests may help pinpoint the cause and determine the best treatment approach. Shortness of breath during light activity isn't something to ignore. It could be an important signal to take control of your blood pressure and protect your heart health. Listen to your body and act promptly to prevent more serious complications in the future. Sign number 6, swollen legs and edema. Have you noticed that your legs swell noticeably by the afternoon, even without any clear reason? Some people may assume it's just from standing for too long or feeling tired after a day's activities. However, if this swelling happens frequently and persists, it could be linked to blood pressure issues. When high blood pressure becomes a long-term problem, it doesn't just affect the heart, it also has a strong impact on kidney function. The kidneys are responsible for filtering blood and removing waste and excess fluid from the body. When blood pressure rises, the kidneys can become damaged or less efficient, causing the body to retain water. This leads to swelling, often seen in the lower limbs, such as the feet and ankles, particularly later in the day. This swelling may also come with a sense of heaviness or tightness in the legs. You might notice that pressing a finger into the swollen area leaves a dent that doesn't immediately bounce back, or that shoes which once fit comfortably now feel tight. These signs shouldn't be ignored, as they can indicate more serious issues, such as heart problems or kidney dysfunction. Furthermore, if the swelling occurs along with other symptoms like chest pain, shortness of breath, or a rapid heartbeat, you should consult a doctor immediately. These symptoms may indicate that your body is under too much pressure from high blood pressure, and prompt attention is necessary to prevent dangerous complications. One of the most effective steps you can take is to keep your blood pressure under control. Regularly checking your blood pressure, especially in the morning and evening, can help you track any unusual changes. If your readings often exceed 140/90 mmHg, it's important to seek medical advice. Lifestyle adjustments are also crucial. Reducing your daily salt intake can help your body retain less water and reduce swelling. Eating plenty of fresh vegetables, fruits, and potassium-rich foods can support healthy blood pressure levels and minimize edema. Staying well hydrated is equally important. When your body has enough water, your kidneys can function more efficiently, lowering the risk of fluid retention and helping the body eliminate waste more effectively. Increasing movement is another helpful strategy. If you sit for extended periods, try to stand up and move around periodically. Walking or doing gentle stretching exercises can help improve blood flow, reduce pressure on blood vessels, and decrease swelling. If the swelling persists or worsens, avoid self-treatment. Consult a healthcare professional to determine the exact cause and the best course of action. In some cases, doctors may recommend kidney function tests or cardiovascular exams to better understand your condition. Swollen legs and edema are not just temporary inconveniences, they can be warning signs that high blood pressure is affecting your kidneys and other organs. Pay close attention and monitor your health regularly to protect your well-being. Sign number 7, sudden blurred vision and reduced eyesight. Sudden blurry vision or eye strain can happen unexpectedly, even if you haven't experienced it before. Many people assume it's just fatigue or too much screen time, but it could be a warning sign of high blood pressure. If you notice that your vision suddenly becomes blurry, unfocused, or strained, especially without an obvious reason, it's important to pay attention. High blood pressure can damage the tiny blood vessels in your eyes, causing long-term complications. When blood pressure remains too high, the delicate vessels in the retina can weaken, narrow, or even rupture. This condition, known as hypertensive retinopathy, can cause subtle vision problems at first, such as difficulty reading fine print or struggling to see objects clearly. Over time, uncontrolled high blood pressure can lead to serious eye conditions like retinal bleeding, fluid buildup in the macula, or even permanent vision loss. Many people dismiss early signs of vision problems, thinking their eyes are simply tired. However, if you find it difficult to recognize faces, read small text, or feel like there's a haze or fog obstructing your sight, it may indicate an issue that needs medical attention. Blurred vision associated with high blood pressure can appear suddenly or progress gradually, making it essential to monitor any changes. Beyond retinopathy, high blood pressure increases the risk of other eye conditions. It can contribute to glaucoma, which results from elevated eye pressure, or optic neuropathy, where reduced blood flow damages the optic nerve. These conditions can lead to irreversible vision loss if left untreated. Those who also have diabetes face an even greater risk of developing diabetic retinopathy, further worsening vision problems. Taking proactive steps can help protect your vision from the effects of high blood pressure. Monitoring your blood pressure at home is crucial, especially if you have a history of hypertension. Regular eye checkups can also help detect early signs of retinal damage before symptoms worsen. Optometrists can perform specialized tests, such as retinal imaging and optical coherence tomography, (OCT), to assess blood vessel health and detect any abnormalities. Lifestyle changes can significantly reduce the impact of high blood pressure on your eyes. Reducing salt intake, eating more leafy greens and omega-3 rich foods, and maintaining a healthy weight all contribute to better circulation and lower blood pressure. Quitting smoking and limiting alcohol can also prevent further damage to blood vessels, reducing the risk of vision-related complications. Staying active through low-impact exercises like walking or yoga can improve circulation and support overall eye health. If you're experiencing persistent blurry vision, eye strain, or sudden difficulty seeing clearly, don't ignore these warning signs. Seeking medical advice early can prevent irreversible damage and help maintain clear vision. High blood pressure affects more than just the heart. It can silently damage your eyesight, leading to long-term complications if left unchecked. Regular monitoring and timely intervention are key to protecting both your vision and your overall health. Susan, 58 years old, is a grandmother who always takes care of her family, cooks meals, and enjoys morning walks around her neighborhood. However, over the past few months, she started experiencing occasional dizziness. Sometimes, when she stood up too quickly, the room would spin for a few seconds before everything returned to normal. She thought it was just due to lack of sleep or dehydration, so she didn't pay much attention to it. One morning, while preparing breakfast in the kitchen, she suddenly felt a strong dizziness. The feeling was so intense that before she could find something to support herself, she collapsed onto the floor. When she regained consciousness, her right arm felt weak and she had difficulty speaking. Her family quickly realized something was seriously wrong and rushed her to the hospital. Doctors diagnosed her with a mild stroke caused by uncontrolled high blood pressure. She had never thought to monitor her blood pressure regularly. She felt fine most of the time and didn't see any issues. But that one moment in the kitchen changed everything. After recovering, Susan became determined to take control of her health. She started monitoring her blood pressure twice a day, once in the morning and once at night. She cut back on salt in her diet by replacing processed foods with fresh vegetables and whole foods. Although she wasn't a fan of exercise before, she started committing to 30 minutes of light activity every day, like walking around the neighborhood or doing simple stretching exercises at home. Over time, she felt stronger, her dizziness disappeared, and most importantly, her blood pressure stabilized. She knew she had been lucky. Her mild stroke could have been much worse. But instead of living in fear, she turned the situation into a turning point to improve her health. Susan's story is a powerful reminder that high blood pressure often shows subtle warning signs until it's too late. But the good news is, you can take simple steps right now to protect yourself. Monitor your blood pressure regularly to stay aware of any sudden changes. Reduce salt intake by avoiding processed foods and choosing fresh, natural meals. Stay active with at least 30 minutes of movement each day to keep your heart and blood vessels strong. Have you ever experienced symptoms like dizziness, blurred vision, or morning headaches? Share your experience in the comments below. Your story might help others recognize a warning sign and take action in time. As we've seen, morning headaches could be more than just a sign of stress or lack of sleep. They could be an early indicator of high blood pressure. By taking small steps, like monitoring your blood pressure, adjusting your diet, and staying active, you can protect yourself from serious health risks down the line. Remember, high blood pressure can be controlled with the right lifestyle changes, so don't wait until it's too late. If you've noticed these symptoms, it's time to take action. Keep track of your health and consult your doctor if you need support. Thanks for watching. If you found this information helpful, don't forget to hit that like button, subscribe for more health tips, and share this video with someone who might need it. And again, please leave a comment below. Let's start a conversation about how we can take better care of our health together.